Thank you. Good morning. Again, my name is Cheryl Mayo, and I am the Principal Advisor for Human Capacity Development with SCMS. And I'll wait for my slides. I am actually presenting this on behalf of my colleagues in our Nigeria program, I'm sorry, Adineke and Edebayo. They were not able to travel, so please be gentle with me. I want to talk to you about how Nigeria looked at how to develop their SCMS staff or workforce using a three-pronged approach. Supply chain capacity at all levels of health service delivery is critical for ensuring a steady and uninterrupted supply chain commodity. It also is very important to create a level of awareness, knowledge, and capacity within healthcare workers and to ensure efficient and use of both the clinical and the commodity services. That was the goal for Nigeria with regards to building the human capacity resource infrastructure. So first, let me give you a little background. The supply chain management systems, SCMS, was established in 2005 as part of the President's Emergency Plan on AIDS Relief, PEPFAR. And it was administered and is still administered by the United States Agency of International Development, USAID. The SCMS provides reliable and cost-effective and secure supply of products and for HIV programs in PEPFAR and supported countries. They also provide short-term and long-term technical assistance to our PEPFAR supported countries. Access to quality HIV commodities for testing, treatment, and care can be impeded when a staff is not properly prepared or they lack the skills in supply chain management. Often it results in stockouts and expiries. In Nigeria, the SCMS set out to build the in-country capacity of their human resources. And through this, they use a three-pronged approach. When looking at workforce development, we need to ensure and recognize that in order for the health workforce to better prepare and to develop them into the skills of using supply chain management and providing supply chain management, they also need to understand the knowledge, the skills, and the application. The three-pronged approach that Nigeria used. First, it was pre-service. Pre-service education was used through 12 universities. And so one of the things that they did is they convened a meeting with the Ministry of Health, and they also convened a meeting with 12 university leaders. And this was done in 2012. And this was a way for them to advocate for a stakeholder involvement, but also for ownership by the country and the officials. Once that they had actually engaged and received the buy-in, they began to look at how they could take their curriculum and be able to adapt it into the pre-service education of the pharmacy undergraduate programs. The next was that they also utilized an in-service approach. And this was for the current healthcare personnel who worked in the Institute of Public Health and also the Ofami Alawano University to implement a logistics management of health commodities courses. And then the last prone approach that they used was an e-learning. And this was through the K4 Health Project and the medical laboratory science credentialing professional bodies to develop content that would be used online for e-learning. So what you see here is they use three different type of blended approaches, and that was through pre-service education, through the in-service mechanism of training, and then also from e-learning. What are our results? In the pre-service training section, 12 academic institutions were onboarded and utilized. Through that, they were able to reach more than 2,300 students, with over 400 of those students graduating. From the continuous education, 3 rounds of training was provided to 52 participants. And then in the e-learning section, the introduction to the medical laboratory supply chain management has been completed by over 1,445 times. So what you see here is, again, they utilized the three-pronged approach to address and to tap into the various different entities of the supply chain mechanisms, but also to be able to identify all of those different individuals and cadres in various different levels. So you had individuals at the pre-service level, and those were your new students, and then you had individuals that were currently performing these tasks in supply chain management within those different organizations and institutions, and then the e-learning, and that was to help those that wanted to continue on their education development and knowledge building of supply chain management. What are the lessons learned in the next steps? Success is due to stakeholder engagement and a buy-in and strategic use of existing educational structures, professional bodies, and the Ministry of Health commitment. And as I said at the beginning, when they looked into expanding their pre-service training capacity, they met with the Ministry of Health to get the buy-in, and they also met with the university leaders. That is how you bring in your stakeholders. And they also looked at the health delivery services to identify what their education and training needs would be valuable or be required. And then they looked at the regulatory bodies to make sure that they were able to link the three-pronged approach for those individuals and those organizations that wanted to build the capacity of students, professionals in supply chain management. In the in-service training for about 30 participants, what Nigeria did is looked at the range of what would be the cost for 30 students or 30 participants in an in-service. And that range from a US dollar is approximately about 31,000 to about 50,000 average, which must be recaptured over time. So as my colleague even led to from Ethiopia, if you looked at the repetitiveness, if you're training 30 participants at a cost of 31,000 to about 50,000, and you have over 500 people targeted or participants, your range of in-service training will be astronomical. And so that's a one-time cost versus what is the cost of a pre-service training. And then more results can be achieved through collaboration and leveraging other expertise and other resources, such as the K4 Health online training. So you look at 3 different levels of training and capacity building to be able to strengthen the supply chain management results. What are the next steps for Nigeria? They are going to continue to expand further to reach more university schools, such as the medical schools, the laboratory schools, and the pharmaceutical schools. And then also to look at public health schools also. And then to be able to make sure that they can actually incorporate their curriculum more further into undergraduate programs, and then looking further to look at master level programs in the future, particularly our technology programs. So in summary, again, the three-pronged approach. Nigeria focused on sustainable capacity building models, and that they felt would be the three-pronged approach. And that was to address pre-service education, to address in-service training, and then to also utilize e-learning as a supportive model for including supply chain training and logistic management and commodities in these programs. The approach can be applied to other knowledge areas also, to, for critical health workforce development and further enhancing of the country's ownership. A key point is stakeholder buy-in and country ownership. And then with the startup and maintenance costs, the three-pronged approach effort has a proven potential for cost savings by reducing discrepancy in cost of in-service training. And then last, over time, the health workforce in Nigeria will gain logistics and supply chain management skills to ensure continued client access to life-saving medicines. This is a picture from the Obama University from the students taking the course in the pre-service monitoring, and then the supply chain training for pharmacy faculty. Thank you so much.